So we've heard it before, but language matters. The way we use our words, the common phrases we hear, and the ways in which language is used by politicians, policies, communities, advocates, activists, and our local shop owner can affect how we interact with, interpret, and understand the world around us. Language is powerful, and this is important. Some will say that alerting people to what they can or can't say goes to problems around policing language, that we're overrun with political correctness, or that it's a curb on free speech. But in this conversation, we hope to show you why it's important to think about the language we use and the impacts it can have. We're speaking with Professor Craig McGarty and Dr. Nida Denson, who will talk to us about the origins of the now very common phrase, social distancing, that we've seen crop up since the COVID-19 pandemic. And we'll be discussing why we should think about potentially using an alternative term, physical distancing, instead. Hi, Craig and Nina. So can you please tell us a little bit about the history of the term social distancing?
Well, you may be surprised to learn that social distancing is not a new term invented in 2020. It was certainly mentioned in a 2011 film, Contagion, about the virus pandemic. And in one particular scene, a character played by Lawrence Fishburne mentions the term social distancing. He's playing a medical doctor who's working for the Centers for Disease Control in the United States. And he says, our best defense has been social distancing, staying home when you're sick, washing your hands frequently. Before that, efforts to reduce or to maintain social distance were referred to in a 2003 public health paper, sort of publication about the SARS pandemic. And the term social distancing also appears in a 2007 report by the Centers for Disease Control in the United States. In 2020, the term very widely used referred to a range of measures to reduce the risk of infection. It's been widely used, it's been widely referred to as the term social distancing, but a lot of people are saying physical distancing is a better term to use, and those problems have been recognised in Canada and elsewhere.
So I'm going to go down a completely different route, as social distancing also has some origins in fashion, believe it or not. So today, face masks may be considered a fashion accessory of sorts that signals to others to keep your distance. So during the bubonic plague, for example, doctors who wore those bird-like masks as a way to keep their distance from sick patients. So these were about ½ foot long. They were shaped like a beak and had these 2 holes near the nostrils, which were filled with perfume. So before the germ theory of disease, they believed that the plague spread through poisoned air. So the perfumes were thought to fumigate this poisoned air. However, it doesn't take a worldwide pandemic for people to want to keep their distance from others, especially between genders and classes. So fashion was the perfect tool for keeping people at an appropriate social distance, like the Victorian era crinoline. This became a marker of class in the 18th century, and it signified to others that you could avoid doing housework, for example, that you had a big enough house that you could move through easily, and that you had a servant that could help you get in and out of your dress. So the bigger the skirt would tell everyone that you had a higher status. These were also good for keeping a potential suitor, or worse, a stranger, at a safe distance from a woman. So as for keeping healthy, germ theory, along with a better understanding of hygiene, led to the popularization of face masks during the 1918 pandemic.
Really interesting to see how this phrase has been used previously. But tell us, why is it a problematic phrase, social distancing, and what phrase do you think we should use instead?
The term social distancing might confuse people, as we want them to remain socially connected. So the term physical distancing is actually preferable. So ideally, people should be physically distancing while maintaining or still continuing to maintain their social connections. So while the virus can be transmitted from person to person, the virus has no power over our ability to support and nurture each other in this time of extraordinary threat. It is especially during this pandemic, that we need to maintain our social connections more than ever. And the Australian Psychological Society has actually put out an information sheet that outlines some of the suggested strategies for coping with feelings of loneliness, isolation, and anxiety that many people are experiencing during this time.
The term social distance has actually been around for a long period of time. It's been used in social science research since at least 1925 by McGarty and others. They use the term social distance to refer to a measure of a lack of connection a person feels with an ethnic or racial group. In other words, social distance referred to a measure of prejudice. Now is not the time to encourage anything that sounds like it might be to do with or promoting prejudice or encouraging prejudice. It's not the time to reduce bonds between the community, and it's certainly not the time to increase anything to do with isolation. It's also the case, as a number of people recognise, that the term social distancing focuses people on the wrong thing. To reduce the spread of COVID-19, we definitely want people to maintain physical distance from each other. If we ask them to focus on social distancing, we potentially are confusing them and directing them to the social rather than the physical distance.
Great, okay, so are there examples or data that show us the effects of this language?
Well, in psychology and in many other fields, we go to a lot of trouble to try to get the language right, especially when that language is used by the general public. So we use the term, for example, sexual orientation rather than the term sexual preference, because preference gives the wrong impression that sexuality is just a lifestyle choice rather than part of a person's identity. Or to take another example, when someone publishes sexual images of someone, perhaps on the internet, without that person's permission, we don't anymore call that revenge porn. And the reason we don't is because the word revenge focuses people hearing that on the possibility that the person who's been subject to that abuse has done something to cause that or potentially provoke that. And that's, again, focusing people on the wrong thing. It's focusing people not on the idea, what people need to be focusing on is the idea that it's wrong to publish intimate images of people without their permission for any reason, not regardless of whether that person has done something in relation to that. So similarly, in the case of social distancing, it's focusing people on the wrong thing. We should begin people to focus upon the physical distance, because it's the physical distance that transmits, that is related to the transmission of the disease.
Well, if people take the term social distancing literally, there are many documented effects of the downsides or negative effects of social isolation. So over long periods of time, extended social isolation can increase the risk of a variety of health problems, including dementia, depression, heart disease, and even death. There's a 2015 meta-analysis that showed that chronic social isolation increased the risk of mortality by 29%. So the research clearly shows that our mental and physical well-being are dependent upon our loving relationships with others. And that's something that we don't want to stop.
Thanks, Nida and Craig. Some really interesting food for thought as we continue to operate in this restrained environment. Thanks so much for your time. Thanks everyone for joining us. We'll see you for another CRIS video soon.